So you have to think of anything with a newborn. It's like watching a computer boot up. Like everything's not online immediately. Like things will start to slowly, come on board and kind of light up at like over the course of like the first year. So, babies are born, their GI systems don't work all, as like they would function as an adult. Like they milk and then you slowly introduce foods. The immune system is kind of the same way. Newborns, the way that they're protected at first is that they get that maternal antibody that goes across the placenta into the unborn fetus. And that's why we recommend that pregnant moms get certain vaccines, is to make sure that those antibodies are, preloaded into the newborn. So they have that maternal antibody for the first 3 to 6 months or so. During that time, the immune system can kind of boot up. You can have the production of, all of the immune cells, B cells, T cells. They're going to start encountering things out in the real world as they are exposed to certain things. So the immune system is going to kind of boot up or ramp up over the course of that first year. And immunizations that are recommended during childhood at certain times, some of them are recommended at those times because the immune system responds best and is fully functioning for that particular vaccine at that time. Some are going to be given later because through clinical trials it has been shown that some of those immunizations just aren't as effective earlier as they are later. So we know the immune system is not really fully functioning 100% until probably about 1 year. But thankfully, we have maternal antibody that will, is on board and helps out in the beginning.